Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm pleased to be joined today by shoulder and elbow surgeon, Dr. Melissa Wright. Today, we're going to be discussing everything you need to know about the rotator cuff. If you've ever felt like you've had a dull ache in your shoulder, you've been damaged, may have damaged or torn your rotator cuff, then stick around, share this broadcast with your friends, and ask your questions in the comments. We're going to talk about common causes of shoulder pain, how it works, how it can be fixed, and when it's important to seek a consult. So Dr. Wright, thank you so much for being here and welcome. Before we begin the discussion, can you tell our viewers a little bit about yourself?
Sure. Thank you so much for having me. I'm really excited to be here and get to share a little bit with everyone here about the rotator cuff. My name is Melissa Wright. I am one of the orthopedic surgeons with MedStar here in Baltimore, and I am fellowship trained in shoulder and elbow surgery. And so that means I take care of all problems of the shoulder, upper arm, and elbow. I treat them both surgically and non-surgically, and that includes everything from broken bones to sports injuries, arthritis, and then, of course, what we're talking about today, the rotator cuff.
Wonderful. Thank you so much. Well, just to put it simply, what is the rotator cuff and what does it do?
Sure. So very common question. The rotator cuff is actually 4 different muscles and they're tendons. And it's called the cuff because it's a cuff of tissue that goes around the shoulder joint. And so each muscle comes from the shoulder blade or scapula, and then it inserts onto the humeral head, the ball of your shoulder. So there's one muscle in the front, the subscapularis, one on top, the supraspinatus, and then 2 in the back, the infraspinatus and the teres minor. And together they work to help elevate and rotate your arm in space.
Wow, thank you. Well, what are some common activities that can aggravate a rotator cuff?
Sure. So because the main job of the rotator cuff is to elevate and rotate your arm in space, things that do that sort of motion in a repetitive way tend to aggravate the rotator cuff. So people that do a lot of overhead activities, particularly any kind of heavy overhead lifting, they're a little bit more prone to rotator cuff problems. We also see rotator cuff problems in our overhead throwing athletes because of the positions that they have to put their shoulder in and the kind of forces that they have to put their shoulder through in order to perform. Honestly, we see rotator cuff problems in anyone though, and sometimes there really doesn't seem to be a specific inciting event or trauma that causes it.
Okay, thank you. So something like this where you're maybe weightlifting kind of over your head or throwing your shoulder, like this is the kind of activity.
Exactly. It's those things where you're bringing this arm back away from your body, you're doing a lot of force overhead. Those kinds of motions are really putting a lot of strain on your rotator cuff. And that's what your rotator cuff is designed for. It helps us do those things, but if you're not doing things in the right way or you're doing a little bit too much too fast, you may set yourself up for a problem with the rotator cuff.
That makes sense. So what kind of injuries could you get as a result of that?
Sure. So we see a whole kind of gamut of injuries related to the rotator cuff. It starts with things just like tendinitis. So that's inflammation of the tendons. And that's more common with kind of an overuse type activity where the muscles and the tendons get irritated, you get inflammation and you get pain, but there's no actual structural damage to the rotator cuff. We also see kind of partial thickness or small fraying, small partial tears of the rotator cuff. Those can be due to overuse or due to trauma. And that really just means kind of parts of the tendon start to peel away from where they insert onto the ball. And then finally, we see complete or full thickness rotator cuff tears. And that can involve one tendon, that can involve multiple tendons. And that's when the tendon actually completely detaches from the bone and is no longer in the position structurally that it's supposed to be, and it can't do its job anymore.
Okay, wow. So we talked about specific injuries that you could get. Is there a difference between an injury or something that is a more gradual onset? You mentioned overuse. What is the difference between those two?
So there's not, you can get sort of this whole gamut of rotator cuff problems in a variety of different ways. But if you have an acute injury, I definitely worry more about a complete tear of your rotator cuff. Especially in a younger person, it's really unusual to completely tear your rotator cuff without kind of a higher energy trauma. And so if there is a trauma and you're having weakness and pain afterwards, I really worry about, a full complete tear, and that can be a little bit more of an urgent issue. If it's more of a repetitive overuse type picture where you didn't do anything specific, but it's kind of been this nagging building pain, you can still have a full thickness tear, certainly, but I worry a little bit less about it in those situations.
Okay, thank you. Who is typically affected? We talked a little bit about people who are weightlifting or athletes. What about men, women, ages, specific arthritis diagnosis? Who is typically affected by a rotator cuff injury?
So they're really, really common to start. Shoulder pain is incredibly common, and problems with the rotator cuff are incredibly common. They affect both men and women pretty equally. We definitely see an age relationship with rotator cuff problems. So the older you get, the more likely you are to have a rotator cuff problem. There is some degeneration of the tissue that happens over time. Actually, there has been studies that have been done where they just take images of people who don't have any shoulder pain or symptoms at all, and about a third of people over 60 without any shoulder pain at all will have a rotator cuff tear. And if you look at people over the age of 70, that number jumps to about 2/3 of people, even without pain, will have a rotator cuff tear. So there's a huge age relationship with rotator cuff disease. Some other risk factors for rotator cuff problems are smoking. High cholesterol actually is linked to a higher incidence of rotator cuff problems. And then family history is very real. So we know there's some genetic component to rotator cuff disease that we're still figuring out, but family history can play a role in your risk for developing problems with your rotator cuff over the course of your lifetime.
Great, thank you. That's great to know. So it's very common.
Very common, yeah. It's one of the absolutely most common things, probably the most common thing I see every day is at least, whether it's just the tendonitis or a full thickness tear, some problem with the rotator cuff.
Yep. Well, thank you very much. If you're just joining us, we are live with Dr. Melissa Wright, shoulder and elbow surgeon, talking about everything you need to know about the rotator cuff. And we have a few questions that have come in from our viewers. So I'm going to take a moment to answer a few or ask you a few of those. The first one is from Sharon. She would love to get another opinion on this. She had surgery on both of her shoulders and there's pain in both of them now, and it's worse than surgery even before her surgery, and she's been refused an MRI. What advice do you have for her?
That it's always hard when you've had surgery and you're not kind of getting the response that you want. The recovery after rotator cuff surgery can be slow and it can take a long time. But if you're still having pain, weakness, difficulty with, your shoulders, and you're not happy with where you are in terms of your symptoms, I think, talking first and foremost to your surgeon about sort of their opinion on what's going on, your options to try and get better. And then, you are certainly always within your rights to seek a second opinion and, see if somebody else has a different thought on your problem and what can be done to help get your shoulders pain-free and functional again.
Great, thank you. And thank you, Sharon, for your question. I have another question for you from Pat. I was given exercises to help and they do. Will that keep being okay, or will Pat eventually need to get surgery?
So this is the $1 million question. Therapy is really important. Stretching, strengthening, those can really help your shoulder compensate for problems in the rotator cuff. And many people, if they're able to maintain their flexibility and their strength around the shoulder, will never go on to having more significant problems. Unfortunately, that's not everyone. And so some people still will develop progression of, if they have a tear already, progression of that tear, or if they didn't have a tear before, can progress to a tear. And with changes in the structure, sometimes what you were able to compensate for prior with exercises and strengthening, you're no longer able to. So I would definitely encourage you to keep up the exercise program, maintain the strength, the flexibility around your shoulder. And I wish you the best of luck that continues to work for you and you never have to cross the threshold of an operating room for your shoulder.
Thank you very much. And thank you, Pat. we'll get back to our viewers' questions, but I have some more questions for you going along with the questions that we got from Pat and Sharon. Can you tell us a little bit about symptoms? What symptoms indicate that there is a problem with your rotator cuff?
Sure. So pain is, one of the very most common symptoms. The pain actually tends to be kind of over the side of your shoulder. And so a lot of people will come in and kind of hold their arm like this. This is where it hurts, even down the upper arm a little bit. And that's really common where the pain from a rotator cuff gets referred to. The pain tends to be worse when you are trying to engage the rotator cuff. And so that's those motions where you're reaching away from your body, putting weight in the hand away from your body. People trying to reach behind their back or up to do their hair, that sort of thing. Those are often activities that are painful when you have a rotator cuff problem. Night pain is really common as well. And so if that pain in your shoulder is keeping you up at night, it could be a rotator cuff problem. And we see that a lot. And then finally, weakness can develop. And so if you have, not just inflammation, but really, you're developing tears in your rotator cuff, people will start to develop weakness with their arm, difficulty kind of holding it up in space, difficulty holding it up if they put even just a small weight, like a cup of coffee in their hand. So those are all things to kind of look out for. A lot of people get numbness and tingling in their arm. I would say that that typically is more related to nerves, and rotator cuff problems themselves don't typically cause as much numbness and tingling in the arm.
Thank you. So when is it time for patients to seek treatment?
So that's up to the individual, but I always tell people that, if your symptoms are interfering with your quality of life, come see somebody. We are here to try to make your quality of life better. And so if you're waking up at night because of pain and, you're not getting a restful night's sleep, come see somebody. If you can't do the things you want to do because that arm hurts or it's weak, come see somebody. If you had an injury, a real injury, and it's not gotten better over the course of a couple of days, even a couple of weeks, it's time to see somebody and make sure there's nothing more significant going on.
Thank you. So what treatments are available?
All kinds of treatments. A little bit depends on sort of how severe your rotator cuff and problem is and what exactly is going on with your rotator cuff. But a lot of the first line treatment for most rotator cuff problems even is non-operative treatment. And so that consists of things like physical therapy, as we talked about, just a few minutes ago, to stretch and strengthen the muscles around the shoulder. There are 17 muscles that attach to your shoulder blade, and making sure each one of them is working in the best way possible is really important for your shoulder health. Oral anti-inflammatory medications, topical anti-inflammatory medications, those are often first line treatment just to help calm down the inflammation around those tendons and get you feeling better. Cortisone shots are something we use in the right patient. Not everybody is a good candidate for that, but many people will benefit from an injection. Mm-hmm. And then ultimately, many people are good candidates for surgical repair of their rotator cuff. And so that's a conversation that's, unique to every person with their doctor based on their symptoms and what exactly their rotator cuff status is. But many people will benefit from an arthroscopic rotator cuff repair.
Thank you. That's a lot of muscles in your rotator.
Yeah, it's my favorite fact to tell patients because it surprises everybody. 17 muscles, there's a lot of them.
Wow, definitely. And also we did hear feedback from some of our Facebook viewers about getting cortisone shots. So I'm glad you addressed that as well, because it seemed to be a way that some of our viewers are already seeking treatment, and it has been helping them.
Yeah.
So what is the long-term outlook for patients with rotator cuff injuries?
So most patients with rotator cuff problems are able to get better. We're able to restore function and reduce pain in their shoulder. As I said, we often start with conservative measures, and there's a lot of different things we can try. So if you're not getting better with the treatment of your rotator cuff, there's often a different step we can take to try and really get you where you want to be in terms of your pain and function. It is important to know that rotator cuff tears do progress over time. We know that from big studies we've done in people with rotator cuff tears over time. And so if you know you have a rotator cuff tear and you've been doing well and your symptoms start to change or worsen, it is important to keep that in mind, that your rotator cuff tear may be worsening. And it's important to seek the opinion of a specialist or your doctor.
That's good to know. Thank you. We had some more viewers joining us, so thank you and welcome to our live broadcast on everything you need to know about the rotator cuff. We do have a question from Dina. The question is, I've had shoulder pain going on for 4 years. 2 years ago, tests showed a bone spur on or near the clavicle, which can infringe on the cuff. The pain is definitely worse now. Can't sleep, which you talked about, sleeping challenges. Can't lift, which you also mentioned. Went to PT, and Melixam doesn't really help me. I'm not sure what that is. Maybe you can address that too for our viewers that don't know about that. What could be wrong that I'm still dealing with pain for this long? I'm 63 and I have osteoporosis. My quality of life stinks. I really can't remember a pain-free life.
Well, I'm very sorry to hear that. That's, 4 years is a long time to be dealing with, pain, and, shoulder pain really does have a dramatic impact on people's lives. It sounds like you've tried a lot of the right things with the physical therapy. And then it sounds like you're on meloxicam, which is, a good anti-inflammatory that we often try for rotator cuff problems. It's hard to know that exactly what's going on with you, but, it may be time to consider, more other treatments, other imaging to make sure that the rotator cuff is still intact. And potentially it's time for a cortisone shot or something like that. And then, I would always, if you feel like you've made progress with therapy and then plateaued before, you can also always try seeing a different therapist. Sometimes getting another perspective on the stretching and strengthening that you're doing can be helpful.
Thank you very much. We have more questions from our viewers. They're coming in. This one's from Lynn. Can a rotator cuff repair itself? And is it better to ice or heat or both?
Sure, those are great questions, Lynn. Unfortunately, from everything we know about the rotator cuff, it will not heal on its own. So if you have a complete tear of your rotator cuff, it can't kind of heal back to the bone without intervention. What we do know is that your symptoms don't always correlate with your tear and what exactly is going on. And so, as I said before, there's a lot of muscles around the shoulder. And so people can compensate very well for a small tear in the rotator cuff. And although we can't necessarily make that tear go away, if we can correct your shoulder mechanics and improve your pain, you may never have symptoms from it again. And then the second part of the question.
Better to ice or
heat. Ice or heat, right. So I usually recommend ice for my patients. That really helps with the inflammation aspect. If you're having a lot of shoulder pain, especially after you've been more active, ice can help. If you're doing a home stretching program, using a little heat in the beginning to help you kind of warm up can be beneficial. But generally for the pain relieving aspects and after a lot of activity, I recommend ice.
Thank you. Thank you, Lynn. There's a question from Nancy. I know we talked about this a little bit earlier, but she is asking about what kind of non-surgical relief do we offer at MedStar Health? Both of her cuffs are torn and she's not a good surgical patient. Could you reiterate some of those treatment options Nancy might have missed earlier in the broadcast?
Of course. And, we're able to get so many people better with non-surgical treatments with the rotator cuff. It's a complex issue, and getting people strong around the shoulder, you can really relieve a lot of their symptoms. So a lot of the things that we try when people have rotator cuff problems and we're trying to avoid surgery are oral and topical anti-inflammatory medications. And so sometimes that's different creams you can rub on the shoulder to try and calm down the inflammation. Oral medications you can take. Physical therapy is really important, and whether that's going to see a therapist or a home program that we develop together where you're making sure to stretch the shoulder and then strengthen all the different muscles around your shoulder. So that's very important, and those are good non-operative treatment modalities that will get a lot of people feeling much better. Injections can help as well, and so certain patients are really good candidates for a cortisone injection. And that, just works a little bit more directly at the source with the anti-inflammatory effect of the cortisone, helping to improve your pain from the rotator cuff.
Thank you very much. We have a question from Karen. She spells Karan, so it's another interesting way to spell Karen. And Karen has I think a very unique question, something that I'm curious to know the answer to. She asks, should I get my COVID vaccine in the same shoulder as my rotator cuff problems?
So that is a question that I get asked a lot of the time now recently. And so that is a great question, Karen. We do not have a lot of great data on this yet. You know, everything around COVID is new. And so this hasn't been studied very well yet. My general recommendation for patients is if they have a problem that we're actively treating for their shoulder, and so that if that's going to be involving potentially injections, they may be considering surgery soon. I recommend that they get the COVID vaccine on the other side. I definitely don't recommend delaying the vaccine or anything like that, but I do recommend getting it on the other side.
Thank you. I have a question from Colleen. Colleen is asking about the cortisone shot. She asks, can it help frozen shoulder? And for those that don't know frozen shoulder, can you also mention that? Is that part of the rotator cuff? I don't know.
So no, that's a great question. Frozen shoulder is another common problem we see in the shoulder, and that's a stiffness of the shoulder that develops. And sometimes people are lucky enough to get stiffness and kind of a frozen shoulder on top of a rotator cuff problem, but usually they are separate entities. And it's an inflammation in actually the lining of the shoulder that leads to that stiffness. But to answer the question, that cortisone, yes, can be a very good treatment option for a frozen shoulder, always coupled with physical therapy. It's really important to make sure you're stretching the shoulder because that's going to be really what makes it better. But the cortisone can help make the stretching a little bit easier and less painful so that you can get that stiffness worked out of the shoulder.
Okay, thank you. I have a question from Ashanti. Why do I still have pain a year later after surgery?
That's a tough question, and unfortunately does happen sometimes. There's a lot of different reasons that you could be having pain still. Sometimes it's due to some lingering stiffness. A stiff shoulder is a painful shoulder, is what I tell all my patients. And so when you're rehabbing after a rotator cuff surgery, there's always a balance of we try to get it to heal without letting your shoulder get too stiff. And so sometimes it's just still a little bit stiff, and different strategies with anti-inflammatories, injections, and therapy to try and get that stiffness worked out can help. You know, sometimes people do re-tear their rotator cuff or don't heal completely. And so those are things that have to be evaluated. And then sometimes the pain is coming from a different source. Cervical spine pain is really common. And it's really commonly, there's a lot of people who have shoulder pain and cervical spine pain. They come together a lot. And so sometimes if people are having residual pain after surgery, their neck needs to be looked at because sometimes it can just be a pinched nerve or a muscle problem in the neck. Those are some of the more common things.
Okay, thank you. I have a question from Patricia. Can anything be done if the rotator cuff is completely torn? Would this be something, a surgical treatment that you would need to do, or could other options be available for you?
So there's always lots of options. If the rotator cuff is completely torn, it depends on how big the tear is, what your options are. Once again, a first-line treatment is often therapy to strengthen the other muscles around the shoulder and anti-inflammatories to help with the pain. And many people, even if the rotator cuff is completely torn, can actually get good function of the shoulder. So a little bit of that depends on kind of your goals and your concern about having surgery. In terms of a surgical standpoint, if it's completely torn, many times it is repairable and we can do surgery. And sometimes if it's not repairable, then there's other options that we have to think about surgically or non-surgically. Again, both the kind of injection strengthening side, or sometimes we do bigger surgeries to kind of use other tissue to take the place of the rotator cuff, or even sometimes replace the shoulder. So there's a lot of different options, even for people with really big or complete rotator cuff tears.
Thank you. I have a question from Pamela. what are the tests given to diagnose a rotator cuff tear?
That's a great
Is it a
question.
test or is it an exam?
So we use a lot of different things. So, I start kind of getting a sense of whether somebody might have a rotator cuff problem, even just from my first questions to the patient, from the history, kind of what happened, where their pain is, when it's bothering them. I can start to get a sense it may be a rotator cuff problem. My physical exam is really important. I look for weakness. I look for pain with certain maneuvers that are really indicative of a rotator cuff problem. And then ultimately, to definitively diagnose a rotator cuff tear, we typically use an MRI of the shoulder. Sometimes we'll use ultrasound as well in patients that can't get an MRI. And very rarely a CAT scan with dye is used, again, if somebody can't get an MRI for some reason.
Okay, thank you. What would you this kind of goes along with that, but Colleen had another question. What would you expect when going to see a doctor about your shoulder?
Sure. So, I can't speak for every doctor, but generally, a history and physical exam are going to be the mainstay of kind of your evaluation. So they're going to talk to you. They're going to ask you questions about your shoulder pain, kind of when it started, how long it's been going on, where it's bothering you, when it's bothering you. A physical examination. So that's going to involve moving your shoulder, testing your strength. And some of those things may be painful if you're having, shoulder pain, but we're not trying to beat you up. We're not trying to make you hurt more. It's just really important that we get a good sense of exactly what your limitations are and, these certain provocative maneuvers to try and help us get a good diagnosis. X-rays are often done as kind of the first imaging study when you're getting shoulder pain evaluated, and many times that will be done at an office visit or prior to an office visit, and those help us rule out arthritic conditions and significant problems with the bone, like fractures or other abnormalities. And then, once you've been seen and evaluated in that way, you and your doctor will come up with a treatment plan that may or may not involve additional imaging studies like an MRI.
Thank you. And to piggyback off of that, when should patients see a shoulder and elbow specialist like yourself instead of going to an urgent care or primary care provider?
Sure. So, I think, as we kind of talked about earlier, if this is really impeding your quality of life, you're having weakness, you're having night pain that's keeping you up, those are more significant symptoms that, I think it's good to get seen and evaluated. And I think another thing that can push you to see a specialist is if you're really ready for treatment, this isn't just something that's kind of lingering and nagging, but you're ready to be seen and treated. And whether that's, that doesn't mean surgery, but, taking a medication or seeing a therapist, I think that's a really good time to go ahead and see a specialist. Obviously, seeing your primary care doctor or urgent care are, really important and those have a role as well. And they can often help you get in to see a specialist if that's where you start.
Thank you. We have some more questions from our viewers. They've been rolling in. Thank you all very much for your questions. As you can tell with all these questions coming in, and as you mentioned earlier, this is a very common condition and things that are and that people are dealing with, and they have a lot of questions to ask you. So I have some more.
Okay.
This one's from Kitten, and she asked, "Can it cause numbness in your hand?" So I guess it being the fact that it's part of your arm, does it cause any issues anywhere else like your hand?
So shoulder pain from your rotator cuff is really common to involve the upper arm and can even go down about as far as the elbow. Typically, if you're having pain that's extending beyond the elbow, if you're getting numbness and tingling radiating down the arm, those things make me more worried about a nerve problem. And that's often coming from your neck and a pinched nerve in your neck. And so if you're getting kind of radiating pain down the whole arm, all the way to the fingers, if you're getting that numbness and tingling, I would encourage you to kind of consider getting the neck evaluated and having those nerves evaluated.
Okay, thank you. I have a question from Barbara. How important is the exercise where you hand your arm and make circles I don't know what exercise she's talking about. Maybe going like this?
She may be talking about a pendulum exercise, which is a
Okay.
really common exercise that we have people start doing to kind of mobilize their shoulder. If this is what she's talking about, you kind of lean forward and let the shoulder rotate in circles. And that's a good early exercise for people that are having kind of a shoulder problem, especially if there's some stiffness in the shoulder, just to help loosen up the shoulder and get it moving. And we use it a lot after surgery in the initial phase as well. Once you have better motion and you're kind of doing more strengthening and stretching kind of in the planes of motion, doing a pendulum exercise isn't maybe quite as important. But, always follow kind of the rehab instructions that your treating therapist or doctor has given you, because they may have a specific reason for that exercise.
Thank you. Do you work closely with the physical therapists and athletic trainers as they are going through the recovery phase?
Very much so. So therapists and trainers are a huge part of our kind of treatment team. And whether a patient has surgery, does not have surgery, physical therapy often plays a really big role in getting them better. And so, I know a lot of the therapists that I work with regularly, but even ones I don't know, if somebody sees a new therapist, I send them notes and instructions about what I want, and they send notes back. And there's a very open line of communication, because the rehab is a really, really important part of rotator cuff recovery, but really a lot of shoulder and elbow problems in general. Therapy is really important.
Yep. Thank you. I have a question from Denise. I have spurs in my rotator cuff. Is surgery my only option? Can you also tell our viewers what a spur is for those that don't know?
Sure. So spurs are typically kind of the word for a bone spur. And so that's a little extra, bit of bone that has formed. You can get bone spurs at joints, and they can be indicative of a little bit of arthritis. And sometimes people get them at the edge of their acromion bone, which is above your rotator cuff. You can get a little bone spur. So that's very common. And I would generally say that surgery is never your only option. And so there's often things to try, even if there is a bone spur that's kind of in that space. There's often things we can try just to control symptoms and kind of alter the mechanics of your shoulder to get you feeling better. And then if those don't work and you're not happy with your function and what you're able to do and your pain relief, then surgery can certainly be an option.
Okay, thank you. This question is from Becky. If stretching or some strength training causes pain, do I push through? She is 10 weeks out of tearing her rotator cuff.
That is always a tough question. Rehabilitation after an injury or after surgery can cause some soreness, because you are pushing your stretching kind of beyond what you've done before. You're trying to build the muscles, and so that causes soreness. The advice I tend to give people is that stretching and strengthening in physical therapy is going to be uncomfortable at times, and you're going to have some soreness afterwards. But that's different than pain. If you're having sharp pain or real pain with certain activities, you may want to kind of dial that back and talk to your doctor or therapist about why that may be hurting. So soreness, kind of some discomfort is normal, but more sharp, real pain, that may be indicative of a problem.
Thank you. Great advice. This question is from Anne. I have been diagnosed with rotator cuff impingement. Will it lead to a tear, and is physical therapy the best treatment?
So kind of the idea of impingement is that rotator cuff in your space above the shoulder, it doesn't have enough space because of just the anatomy and the structure there. And so you tend to get inflammation, and that causes pain. It does not necessarily mean that you will develop a tear over time. We don't know for sure that those are always linked. A lot of people can have sort of problems with impingement and inflammation and then never develop a tear. So I do think that the therapy is a really good way to try and get your symptoms under control, because that can help, again, strengthen all those muscles around your shoulder, get your shoulder kind of operating in the most mechanically advantageous way, and so hopefully prevent the development of any kind of tears or more significant problems down the road.
Thank you. We have a question from Shelley. Would a brace help with pain?
So unfortunately, braces are not always great for the shoulder because our shoulders are made to move so much. And so sometimes a short time in like a sling to kind of rest the shoulder can help, depending on what's going on. If you had kind of an more acute injury or onset of pain. But shoulders are a bit prone to getting stiff. And so generally getting a shoulder moving again in sort of gentle directed ways is really important after an injury or when you do have shoulder pain.
Thank you. And let's talk about anything in research and innovation. Is there any exciting innovations, research, or technology on the horizon for the rotator cuff?
Yeah, there's always lots being studied in shoulder surgery in general. It's one of the reasons why I love this field. And the rotator cuff, certainly there's a lot of research going on there. There's a lot of research being done into kind of the genetics and the biology of rotator cuff disease in hopes that we can identify people who are at risk maybe earlier, or who is at risk of having, progression of their problem or to a bigger tear. So that's exciting research. From kind of a treatment standpoint, there's a lot of work being done on stem cell therapy, and people probably heard of like platelet-rich plasma or PRP type injections. And so there's a lot of research being done in that field in terms of whether we can develop, an injection, a stem cell treatment that may help to heal, rotator cuff tears or help calm down the inflammation. And so, I don't think we're quite there yet, but I'm excited that a lot of that research is being done and hope to have, good, well-studied treatments along that line to offer my patients in the future. From a surgical standpoint, there has similarly been a lot of research on sort of biologic augmentations to surgery. So when we do surgery on the rotator cuff and we repair the tendon, sometimes the tendon isn't in the best of shape. And so there's been a lot of new technology with kind of different tissue patches and things like that to help improve the biology of the repair.
Great. Thank you very much. We have a lot of people who are asking, how do they make an appointment with you, Dr. Wright? Which we will certainly share in the comments. But before I ask you your final question, so we can get people started with that process, could you share how people can contact you?
Sure. So my office is, do you just want me to give them the number?
Yeah.
Yeah, it's 410-554-2272. And that'll get you to the schedulers who can get you an appointment. I see patients at MedStar Union Memorial Hospital, at MedStar Franklin Square Hospital, and out in Westminster as well. And certainly happy to see anybody with any kind of shoulder problem.
Wonderful. Thank you. Yeah, I wanted to people are anxious to get their shoulder pain treated. So wanted to get that question answered, and we'll certainly again share a link to learn more about you in the comments. But I do have just a few more questions for you in the time we have left. We have a question from Alicia, and it's about posture, and I'm feeling like I'm slouching a little bit as I'm reading it. She asked, do you feel that posture exercises will help greatly with helping the rotator cuff? I have a feeling that my rounded shoulders are not helping my situation, and yeah, I'm going to be it's not great posture right now.
She's probably right. Like I said before, there's a lot of muscles around your shoulder, and a lot of them connect to your back and have to do with your posture. And so, we spend a lot of time forward at our computers. Even when we go to the gym, we spend a lot of time kind of strengthening the muscles in the front. And so making sure to pay attention to kind of your back and keeping your shoulder blades, nice and square along your back, strengthening the muscles in your back. That also attach to your shoulder blade. Those are all really important things for kind of minimizing your risk of shoulder pain and problems down the road.
Thank you. And last question from our viewers is from Lynn. I don't know exactly if this is, you'll tell me if it's not a rotator cuff question, but what do you think of TENS units, TENS, and what do they do? Is that?
So there is a treatment, it's a pain control treatment that's often used by therapy, and it uses some electrical stimulation to help with pain relief. And so they can be helpful for people. And so it's usually something that you would try with your therapist. And, not everybody gets help and relief from pain with a TENS unit, but some people do. And so it's certainly something that can be considered.
Okay, thank you, Dr. Wright. This was just wonderful information. I know our viewers had a lot of wonderful questions and you gave them a lot of great advice. Before we wrap up our broadcast, what message do you have for people and our viewers who are dealing with that shoulder pain?
I guess, I would just say, don't be afraid to come in and get it looked at. Shoulder pain is really common, and it really can have a pretty significant impact on your quality of life. And I think a lot of people are worried that if they come in and get seen, it means they have to have surgery. And that's really not always the case. And even if it is the case, I promise it's not as scary as it, or as painful as people may say. So if you're suffering from your shoulder, just don't be afraid. Come in, find out what's going on, understand your options, and that can be really empowering.
Well, thank you very much for your time. We really appreciate it. I know our viewers did as well. Thanks again for joining us and asking your questions. Feel free to share this broadcast with your friends. I'm sure that your friends and family would benefit from hearing more about the rotator cuff and the treatment options available. So we'll see you next time. And thank you again, Dr. Wright, for your time today. We really appreciate it.
Of course. Thanks for having me. It was fun.
Bye, everybody. Have a great day.
Bye.